Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, a podcast endorsed and sponsored by kidneysolutions.org. Hello everybody, this is Kent Bressler. We're going to do some podcasting today, and I'd like to start with prayer. Dearest Lord, we have a supposed increase in the virus called the coronavirus, and it's going worldwide. I'd ask that you put a stop to it and protect those who are already infected, but protect those also, all the folks that may come in harm's way with this. But I want to ask you to provide some peace and some comfort to this general population. Let's look at this thing as you would look at it. Help us through our troubled times, but most of all, thank you for all you've done for us and all your continued grace. We ask this in your name, amen. Well, been on the internet quite a bit. I'm not a connoisseur or a big speed guy on all of this stuff, but I can tell you there are a lot of things that are coming into my email, a lot of things that are on the internet, on the talks that like Transplant talks, and I want to tell you there's a lot of misinformation going on this coronavirus, or what they call COVID, COVID-19, COVID-19. This is a new strain, and it's causing quite a bit of panic. I think you can call it panic, indecision. But I want to speak to you straight today about this COVID-19 virus. I'm going to try to put some general guidelines out there that you've probably already heard, but if you haven't, I want you to hear them, because if you are a transplant or dialysis patient, if you have kidney disease, you are compromised. You are susceptible to this, just like any other flu or any other virus. Okay. And when you get a complication like a virus, it's not a good thing to have if you've been transplanted or you're on dialysis. So let's talk about that a little bit this morning, but also let's think about how we're going to approach it. Are you going to approach everything in a panic mode, or are you going to get your information where it's really, really vital? It's also up to date. I recommend to you that if you want information on this COVID virus, I want you to go to cdc.gov. This agency, cdc.gov, has a tremendous, very important to get the best information, and I think this is where it's going to come from. This is not going to come from the top of my head. I'm going to give you information directly on their website. It's for those who probably maybe not have the ability to access it, more so just so that you get it a couple times. You hear it a couple times more, and it sticks with you. Okay, so what is this COVID-19? This is a respiratory illness that can spread from person to person. And the virus that causes it is called COVID-19, and it's novel. In other words, it's a standalone. It's a first timer. It's not like flu A or flu, the different types of flu, but it's a flu of its own. And it started in Wuhan, China. You know that very well. And it is spreading from person to person in parts of the United States, mainly at this point on the West Coast, as there are cases in New York, cases in Florida, and they're spotty all around, and there's been deaths. to be honest. There have been deaths. So the takeaway point on this is, how well do you know about things about this virus? It's higher for people who are in close contact with someone. If you're going to get this virus, you probably are going to be standing within 6 foot of them. Okay, that's what it takes in order for you to really get this virus. It's a close contact virus. But if someone comes along and has the virus, sneezes in the area, or hacks or coughs, and it gets on a surface, that this little dude can stick around for a good while. And so it makes sense. And if you're like me and Jason and all the folks that have been transplanted or are on dialysis, these are common things that you can do just to make sure you're safe. And you have to be doing them anyway, whether you're trying to stay away from the virus itself. Okay, and we'll talk about that a little bit, a little later. This first reported case goes back to January 21st in the United States. So the current count of cases in the United States can be found on the webpage. I don't think it's important for you to know all these stats, but go to cdc.gov and take a look. All right. The virus that causes this COVID-19 probably came from an animal source. Not of importance where it came from. Important thing, it's going person to person now. Okay. The virus is thought to spread mainly between people who are in close contact with one another, like within 6 feet, like I mentioned. And it comes through respiratory droplets produced when an infected person coughs or sneezes. And it's also possible that a person can get this by touching a surface or an object that has the virus on it. And then you go to touch in your mouth, you touch your nose, you touch your eyes. That's when the virus is going to spread. And again, you can go to this website if you want to get down and dirty on everything. Just go to that website and it'll tell you all you want to know about it. And it's the truth. It's not somebody's abridged version of what they think has happened to it or what it's going to do, or the thought that, oh, it's going to spread into a pandemic episode. And no. Go to cdc.gov and get the facts. Okay, so what are the symptoms? No different than a lot of the flu symptoms. This respiratory illness, again, respiratory illness starts with a fever, you get a cough, and you get short of breath. Those are all signs of a respiratory illness. Now, what's significant, if you're a person who has kidney disease or are immunocompromised, I've said this before in some of my talks and in my conversations. If you have fever, shouldn't have it. If you have a cough, it's time to seek help now. Don't wait till you get short of breath or you start wheezing. Don't think it'll go away, because it's not going to go away. All right? Don't self-medicate, go over. Get to a physician, your nephrology, your transplant team, wherever you need to go to your PCP, but get medical help. Don't wait till you get short of breath and start wheezing, can't draw a breath, get so sick that you can't even get out of bed. Then that's when people have trouble. All right. And in all honesty, this disease, this respiratory illness that we're talking about, COVID-19, usually causes deaths in the elderly population, but it can complicate someone who already has a compromised immune system like us. All right. So don't be afraid of those symptoms. They're there to get you motivated to do what's right, and that's get to your physician. Don't mess around with it. I want to tell you that this virus itself, what it can progress to, not in everyone. I'm saying this as a possibility. It could happen if you're not taking care of yourself. Some patients will develop a pneumonia in both lungs, and they'll experience failure in some of their organs, like in their heart, their lungs, liver, and that can cause death. So let's be honest. Are we going to worry about those things happening to us, or are we going to worry about taking care of it early on? I advocate for you to do it early on. Be proactive. If you have a fever, a cough, or you develop shortness of breath, don't hesitate, even if you got to go to the emergency room. Let's get on top of it before it gets out of hand. Okay, protecting yourself. And I know if you haven't heard about how to protect yourself since you've been on dialysis or had a transplant, or if you haven't been reading, you haven't been listening to the news, and you're isolated, maybe hopefully this will help you figure out what to do. First of all, you need to avoid close contact with people who are sick. You don't need to be nursing people back to health. If they're sick, you need to stay clear. All right. Sickness spreads by contact. Avoid touching your eyes, your nose, and your mouth with unwashed hands. I don't think you should touch your face at all. If you can just make sure you don't do that, it'd be great. All right. Now, wash your hands. You know, this seems so silly that people don't realize the importance of how you need to wash your hands with soap and water for at least 20 seconds, not 20 minutes, not 2 days. We're talking about 20 seconds. That was 20 seconds. That pause right there was 20 seconds. That's not very long, but it needs to be vigorous because studies show that friction, the more you rub your hands together with this soap and water, you're destroying the organisms. You're not just displacing them with spread of water or alcohol. Wash them consistently, front and back, and then dry them off and be done with it. But that's how you wash. If you can't wash with soap and water, you can use alcohol-based hand sanitizer. You can carry it with you. It's okay. But you got to make sure that you provide the friction with it, not just spray it on and rub it on like a lotion. You have to provide the friction. Friction is what kills this virus. Okay. So if you're sick and you don't want to spread it, and I know you don't want to, stay home. Who says you have to go anywhere? If you're working, you know, if you take it with you to work, shame on you. If you know that you're sick, you need to make sure you protect yourself and others, and that includes your family, whether it's the kids or your wife. You know, those people that are around you, those people are the most important people, and you sure don't want to pass it on to them. All right? If you sneeze or you cough, you know, I saw it yesterday in church. I saw it yesterday on the street. People just hack and they sneeze and no protection. All right. So whatever you do, if you sneeze, you do it in your elbow. Put your face, bury it in your elbow, and sneeze into that. Okay. Don't sneeze into your hands. You sneeze into your hands and go touch somebody, or you go turn a knob on the door or whatever. You're just passing it along. So sneeze into a Kleenex and then dispose of that Kleenex. Then you got to wash your hands. All right. And throw that tissue in the trash. All right. Clean and disinfect. Let's not panic on this, folks. I know there's a big move to get Lysol and Clorox and you know, all of this. But clean and disinfecting frequently touched objects and surfaces is important. You know, your computer, if you're working with a computer and like we're working with iPads and we're working with equipment, our cell phones, oh my gosh, your cell phone is like a microbiology lab itself. It's all right. So it's okay to turn it off, wash your hands, and then clean it off. Clean your computer screens off. Clean your iPads off. Anything that you're coming in contact with needs to be clean. But you don't have to do this every 5 minutes. Think about it. If you're the only one using it and you're okay, just cleaning it keeps you okay. All right. So I guess I kicked that horse hard enough for a while. Let's talk about travel. I have several dates that I was greatly looking forward to. One was the summit in Washington, D.C., which is coming up the end of this week into next week. I don't know if we're going to have that. Preferably, I'm going to rest assured that if the people in charge of this program want to make a decision, I'm going to stand by that decision. I don't think we should be traveling. I'm not scared to. If they have it, I'm going. And I've been traveling my whole life, right? Especially after the transplant. I didn't have this transplant to sit home and cover up. I had this transplant to live. And by golly, I'm going to do it. And I'm going to be smart about it, though. If they aren't going to have it, that's okay. If that's a protective mechanism for the population, it's not about me. It's about all you folks out there with the transplant or who have this kidney disease. We'll do what they think, and also have a trip that I wanted to go to California, out to a place. CareDx has a new application, and they were going to talk about this application for patients with kidney disease, or most with who have had transplants, and I was really looking forward to that. But that's a kind of like a center for this disease process now out in the West Coast. So I really have to think hard. It's not till April, so I think I've got a couple more weeks at least to think about it, right? We don't have to go off half cocked or half loaded here. What we need to do is think through this stuff, all right? Don't panic. Be sensible. Be concerned. Don't poo-poo it. It's important to be concerned about this, because I'm telling you what, if you get it, you get sick. All right? And remember, there's no vaccine. There's no magic bullet. If you get this, it's all symptom control in the hospital. That's exactly what it is. Fluids, things that it's going to be turned over to the medical professionals to take care of you if you get sick. Even if you don't have the virus and you have symptoms of fever, cough, respiratory distress, get to the hospital, get to the emergency room, call your doctor. But whatever you do, don't lay down and rest and think it's going to go away. It won't. Trust me. I believe I honestly had a virus last year. A good friend of mine, I will tell you that he has been transplanted for 49 years. And he got a very severe respiratory syndrome last year, was in the intensive care unit. And old Kent, he decided he was going to go and help him out because he was concerned about him. And that's what I got. I got slapped in the face and I got exactly what he had. Only he was just real close to having to go on a ventilator. Had the care that he was been given earlier, I really honestly believe he wouldn't have gotten as far as he did, but he waited. You wait, you pay. All right? You go early, you have a higher degree of success. And just because you're out 1 year, just because you're out 3 years, 5 years, 10 years, 30 years, does not make you any different than the regular person who is just transplanted. Your body is susceptible because it's suppressed. It's immunosuppressed. It's got nothing to fight off the bad boys, all right? So it's up to you to be smart. If you can't be smart, find somebody who can help you with it. Because I can tell you what, you don't want this. You don't want any type of virus or any type of respiratory difficulty, and only you can make sense of it and get to the doctor quickly. Don't wait. Let them tell you, it's okay, you're doing fine. Let's do this, but at least get on some treatment, right? It might be simply just being breaking your fever with medication, but do not do this yourself. I absolutely, please go to the physician and get them to help. All right. Cough, fever, any type of respiratory distress right away. Don't wait. Okay. Now that's all I can talk to you about on this session because I don't want it to go forever. I just want you to be paying attention. So do you remember where I told you to go to? cdc.gov. That simple. cdc.gov. Get your information there. And then if you want to spread information, you'll be spreading the right thing. Okay? This might sound kind of odd, but keep breathing.